Thank you, Steve, for kicking us off and for explaining to the folks gathered here why this topic is of such keen interest and importance to the United Way. I am also a member of the Health and Independence Impact Committee of the United Way, along with my co-moderator, Nancy Feldman, and the committee has done a lot of work to try to frame how United Way might best contribute to community solutions around important public policy issues such as this. And today's forum is certainly an example of our attempt to bring information and dialogue to bear on this very important topic. Well, our first panel is to talk about the looming, urgent, very, very complicated and very compelling and important topic of the looming elimination of the General Assistance Medical Care Program, or GAMC. But General Assistance Medical Care truly is one of the things that has distinguished our state's approach to health financing and health care access for many years. It was started by the legislature in 1975. And really was a piece of far-sighted legislation aimed at making sure that the state's vulnerable populations had access to the right kinds of health supports to maintain their health. The legislature saw this certainly as sort of a safety net, last resort kind of a program for those of our citizens not eligible for medical assistance or for any other state or federal program. The legislature's goal in doing this was to create a system of really uniform statewide support in terms of the uniformity of benefits and the availability of financing for really this kind of urgent care for people facing an utter lack of access to health insurance or health care in any other way. The legislature back in 1975 really saw the potential for the lack of such a safety net coverage program to create tremendous cost shifting across the state as costs otherwise not covered would be shifted to providers and then on to people covered by private insurance, which we certainly have seen over the years. The legislature also sought to create a program that was funded in an equitable way through the state general fund, through state income tax, rather than relying on local property taxes to fund what could become a very patchwork quilt kind of an approach to fundamental safety net services. I think it's kind of interesting to reflect back on that history and to appreciate the goals that the legislature had back in 1975, which still are very, very important goals that the state must address if we're going to see the replacement of GAMC or to contemplate the consequences to the community if GAMC goes away without any replacement. GAMC today is a state-only funded program out of the general fund. At any one point in time, we're talking about 35,000 Minnesotans who are provided health services through the GAMC program. And the GAMC eligibility level, again, this is for people who do not qualify for medical assistance. General Assistance Medical Care provides coverage for adults making up to $8,000 a year. That's a year, which is 75% of the federal poverty guidelines. So when folks have talked about these being some of our state's most vulnerable citizens, I think you can quickly appreciate just from a sheer income perspective how challenging it is to meet the necessities of daily life on $8,000 a year without access to any support for health coverage other than through this program. I think everybody in the room probably understands the urgency of this topic, how it is we came to the point where the General Assistance Medical Care Program is scheduled to be eliminated from our state on March 1st of this coming year. This was a part of the lack of a balanced budget agreement in the 2009 legislative session, of course, leading to the governor's decisions with respect to the line item vetoes at the end of session and then the unallotment decisions, which accelerated the ending of the GAMC program. Because this is scheduled to be eliminated at the moment with no plan for a replacement source of coverage for this population on March 1st, we really are facing quite a timeline crisis here. And it's a good thing to know and not a surprise given our Minnesota culture that there are a lot of folks working very hard right now on very, very fast timelines to try to come up with good thinking, consensus approaches to what can we do about this? What can we do to avoid the absolutely unimaginable, really, I don't think is too strong a word to use, the consequences of the failure to do something to respond to the lack of GAMC support for this population. And we're going to hear from the providers of a lot of these services about the specific effects that would be predicted if GAMC were to go away without any other sort of public policy intervention to take its place. But because we're talking about a very short timeline here, there's not time, frankly, for the usual legislative process. Folks are working very hard to try to find consensus around principles that many folks can agree to without regard to political point of view. There's just an awful lot of economic and human reason why we need to make this a high priority to fix this issue in the very, very near future. Certainly, the Department of Human Services' recent announcement that people currently on GAMC as of March 1st would be given an automatic rollover into Minnesota Care for at least 6 months was a welcome development, although frankly only a partial and even very temporary solution. And I think we will hear from many of the folks on the panels today about why that is not sufficient in and of itself, though certainly an appreciated step in the right direction. The range of folks who comprise the GAMC population, I think, would be illustrative or surprising to many folks. Many of us may have a particular image in our mind of who the GAMC population is. But again, I would just remind you that these are folks of very, very low income who do not qualify by virtue of either their age or their disability status for any other program. So the GAMC population is neither young enough, nor old enough, nor disabled enough to qualify for medical assistance, which doesn't mean that they are not in need of services or in great danger of becoming disabled. Certainly a concern and something that we see directly at Courage Center. But the folks on GAMC run really a wide range of people, people who've lost their jobs because of a health crisis, people who have suffered a medical crisis and then have lost their jobs, or people who have lost their jobs and by virtue of losing their jobs have lost their insurance and then developed the medical crisis. We're talking about veterans coping with post-traumatic stress disorder, people battling serious and persistent mental illness or chemical dependency, quite possibly unrecognized traumatic brain injury, homemakers who've lost eligibility for Minnesota Care as their children have aged out of the program, aging people who are late in their working careers, perhaps lose a job in this tough environment, have a very hard time finding other employment, but are too young to buy into Social Security. And those young adults, those young immortals who have not yet purchased insurance, who experience a significant traumatic event or another kind of sudden major illness requiring costly treatment. All of those people would have a very, very difficult time, even without such significant income limitations, being able to access insurance in the private market, but for one reason or another do not qualify for any other source of coverage. St. Stephen's interviewed literally hundreds of their clients to ask them, from the context of their own individual circumstances and lives, what would happen if they were to lose access to these benefits. And we're going to see that video in just a moment.